Well, we'll start with nursing homes. Alongside prisons and other congregate settings, they're going to be our highest risk. So Director Maureen Corcoran and a whole team have been working side by side with the industry nonstop since this began. We have an extensive set of guidelines, and I would say if there's any way there's a nursing home that is not tied into these guidelines, go on our website, talk to the Nursing Home Association. That work is out there on how to best handle an outbreak. So what we've been able to do thus far, when we're approached by a local health department or a nursing home, we have a strike team. We actually take our epidemiologists, our doctors alongside that team and walk them through the best practices. But I can tell you, they are suffering out there from a shortage of PPE. Tell us, tell your local health department, throw a red flag, tell the Nursing Home Association. We need to know we do have, again, scarce resources, but we are coming alongside the nursing homes that reach out to us and helping you navigate this outbreak. And then we're also working with you on how to best, what patients should stay in place, how to best protect your staff, what patients need to go to a hospital. And we also then, when someone is discharged from the hospital, need to be using consistent guidelines across the state, which exist, to help get those folks back. So this is ongoing work. The state has been involved in it. The communication of that sometimes does not reach everywhere, and so I have a whole team whose only job it is to keep pushing this guidance out. But if you are a nursing home sitting there alone and you need help, reach out to your local health department. They will reach out to us and we will be there with you. Social determinants. So this is all of the conditions that surround us, from our housing, from our pre-existing health, that we know is disparate, and we know that those issues are being further exacerbated at a time like this. I want to say this. I will be tomorrow talking more about the issue of social determinants on health. This is a huge strain on our social services. Every one of the nonprofits are dealing with the same issues: staff out, staff sick. You know, everyone's budget is being cut right now. Whether you're my agency, my budget is being cut drastically to get through this period. To every nonprofit, this is something I think we need a larger discussion about by our leaders. This will be something that needs to be discussed nationally, because the lifeblood that helps us surround people who fall between the cracks is a complex one. It is the state, but the state is one player alongside nonprofits. Our philanthropies have come to the table to try to help, but they're all struggling. Food banks are struggling. We're all struggling. So that infrastructure, that safety net, is really being tested in ways it never has before. So in a place like Youngstown, where I grew up, people like me growing up the way I grew up, workers on the front line who can't afford to stay home right now, who are in essential businesses, are disproportionately represented. And this is a dialogue. It's so much bigger than I can do now, but it's one our nation needs to have.